10 hidden causes why you lose balance after 60. Have you ever wondered why, as the years go by, maintaining balance becomes increasingly difficult? What if a seemingly harmless fall could change your entire life? How can you spot signs of instability before a crash happens? After the age of 60, remaining firm and stable goes beyond just avoiding stumbles. It is a matter of integral health. Every small imbalance reveals that our body is trying to communicate. Are your eyes, ears, and muscles delivering silent warning signals? Falling is not just a physical incident. It can also trigger a cycle of fear and inactivity, reducing your confidence and autonomy. Did you know that a simple adjustment to medications or strengthening exercises could be the key to maintaining your independence? Stay until the end, because cause number 9 is the most serious, and few people know about it. Impact of falls on health. Why can a fall be more dangerous than it seems? Falls are the leading cause of injuries and hospitalizations in the elderly. Even a seemingly harmless fall can have serious consequences, such as fractures, concussions, and loss of independence. As we age, our bones become more fragile, and recovering from injuries becomes more difficult. Additionally, fear of falling again can lead to reduced physical activity, creating a vicious cycle of decline. Therefore, preventing falls is essential to maintain health and quality of life in old age. Read on to discover the hidden causes of loss of balance and how you can control them. 3 things happen to your balance as you age. 1. Visual system. Are your eyes revealing more than you think? As we age, visual acuity decreases, making it difficult to perceive obstacles and changes in the terrain. Common eye diseases in old age, such as cataracts and glaucoma, can further affect vision. Additionally, contrast sensitivity and adaptation to reduced light become slower, increasing the risk of falls in poorly lit environments. Therefore, taking care of your eye health is essential to maintain balance. Discover below how the inner ear is also involved in stability. 2. Vestibular system. The internal structure of the ear may be the blame for its instability. The vestibular system, located in the inner ear, is responsible for detecting head movements and orienting the body in space. With aging, the sensory cells of this system begin to deteriorate, affecting the perception of balance. Vestibular disorders such as benign paroxysmal positional vertigo, BPPV, and labyrinthitis become more common in old age, causing dizziness and unsteadiness. Taking care of hearing health and treating vestibular conditions is crucial to preventing falls. But balance doesn't just depend on vision and hearing. See below how your muscles and joints also play an important role. 3. Somatosensory system. What are your muscles and joints trying to tell you? The somatosensory system is responsible for providing information about the position and movement of the body through receptors in muscles, tendons, ligaments, and skin. As we age, the sensitivity of these receptors decreases, making it more difficult for the brain to perceive the position and movements of the limbs. Additionally, loss of muscle mass and strength, known as sarcopenia, contributes to postural instability. Staying active and strengthening your muscles is essential to maintain balance. Top 10. Hidden causes of loss of balance and how to control them. 1. Medication side effects. Your medication may be affecting your stability without you realizing. Several common medications in old age, such as antihypertensives, antidepressants, and sedatives, can cause dizziness and instability as side effects. These symptoms increase the risk of falls, especially when multiple medications are used simultaneously. It is essential to regularly review all medications with a healthcare professional and report any adverse effects. Adjustments in doses or substitutions for safer alternatives can make a big difference in balance, but medicines are not the only villains. Find out below how a condition called Meniere's disease can affect your stability. 2. Meniere's disease. Did you know that this condition can cause intense vertigo and hearing loss? Meniere's disease is an inner ear disorder that causes recurrent episodes of vertigo, tinnitus, hearing loss, and a feeling of pressure in the ear. These symptoms can last from minutes to hours, significantly affecting balance and quality of life. Although the exact cause is unknown, it is believed to be related to changes in the amount or composition of fluid in the inner ear. Treatment includes medications to control symptoms, dietary changes, and in severe cases, surgical procedures. If you experience frequent vertigo, be sure to consult a specialist. 3. Osteoporosis and bone fragility. Fragile bones increase the risk of falls. Is it time to strengthen them? Osteoporosis is a condition characterized by the loss of bone mass and deterioration of the bone structure, making them more fragile and susceptible to fractures. Seemingly harmless falls can result in serious injuries, such as hip fractures, when osteoporosis is present. Furthermore, pain and fear of new fractures can lead to reduced physical activity, further increasing the risk of falls. Preventing and treating osteoporosis through a diet rich in calcium and vitamin D, bone-strengthening exercises, and, when necessary, medication, is essential to maintain bone health and balance. But osteoporosis isn't the only condition that affects stability. Find out below how visual problems can be more dangerous than they seem. 4. Visual problems. Blurred vision can be more dangerous than it seems. Visual problems such as cataracts, glaucoma, and age-related macular degeneration are common in old age and can significantly affect balance. Blurred vision, reduced contrast sensitivity, and loss of visual field make it difficult to perceive obstacles and changes in terrain, increasing the risk of trips and falls. Furthermore, adaptation to reduced light becomes slower, making movement in dimly lit environments more challenging. Performing regular eye exams, treating visual conditions, and adapting the home environment with adequate lighting are important measures to prevent falls. 5. Chronic diseases, such as diabetes and hypertension, are undermining your balance. Chronic illnesses, such as diabetes and high blood pressure, can affect balance in several ways. Poorly controlled diabetes can cause damage to peripheral nerves, neuropathy, resulting in loss of sensation in the feet and making it more difficult to sense the position and movement of the legs. Hypertension can lead to episodes of dizziness and fainting due to sudden drops in blood pressure when changing positions, postural hypertension. Controlling these conditions through medication, diet, and regular physical activity is essential to minimize their impact on balance. But the threats to stability do not end there. Discover below how small changes in your head can cause big imbalances. 6. Benign paroxysmal positional vertigo, BPV. Small changes in the head can cause major imbalances. It is one of the most common causes of dizziness in old age. This condition occurs when small calcium carbonate crystals move into the semicircular canals of the inner ear, responsible for detecting head movements. This causes episodes of intense vertigo triggered by changes in head position, such as lying down, turning over in bed, or looking up. Treatment consists of specific maneuvers, such as the Epley maneuver, that aim to reposition the crystals, relieving symptoms. If you experience dizziness when moving your head, consult an otoneurologist for an accurate diagnosis. 7. Vitamin B12 deficiency. This vitamin may be the key to avoid dizziness. Vitamin B12 is crucial for nervous system health, and its deficiency can lead to nerve damage, muscle weakness, and balance issues. Aging can impair B12 absorption due to reduced stomach acid, and medications like metformin and omeprazole can further hinder its uptake. Regularly monitoring B12 levels and using injections or high-absorption supplements when needed can prevent deficiencies and protect balance. However, balance problems aren't just about nutrition. Inner ear inflammation can also silently impact stability. Stay proactive in identifying and addressing these hidden risks to maintain your well-being. 8. Labyrinthitis, the silent villain that may be affecting your inner ear. Labyrinthitis is an inflammation of the labyrinth, the structure of the inner ear responsible for balance. This condition can be caused by viral infections, bacterial infections, or autoimmune disorders, resulting in symptoms such as vertigo, dizziness, hearing loss, and tinnitus. Unlike BPPV, dizziness in labyrinthitis is usually constant and is not related to specific head movements. Treatment includes medications to control symptoms, rest, and, in some cases, vestibular rehabilitation therapy to help the brain adapt to altered signals from the inner ear. If you experience persistent dizziness, be sure to see a doctor for a proper diagnosis. 9. Age-related hearing loss. Is it time to take better care of your ears? Hearing loss is one of the most common conditions in old age. affecting around a third of people over 65 years of age. In addition to making communication difficult, hearing loss can affect balance in several ways. First, hearing provides important cues about the environment, helping to orient the body in space. Second, hearing loss is often associated with damage to the inner ear, which also houses the vestibular system responsible for balance. Getting regular hearing exams, treating ear infections, and wearing hearing aids when needed can help preserve hearing and balance. But threats to stability are not limited to the senses. Discover below how a sedentary lifestyle may be compromising your stability more than you realize. 10. Sedentarism and muscle weakness. Lack of activity may be compromising your stability more than you think. A sedentary lifestyle and muscle weakness are significant risk factors for falls in old age. Lack of regular physical activity leads to loss of muscle mass and strength, sarcopenia, making it more difficult to maintain posture and react to imbalances. Furthermore, a sedentary lifestyle can aggravate conditions such as osteoporosis, cardiovascular disease, and diabetes, which also affect balance. Incorporating muscle strengthening, balance, and flexibility exercises into your daily routine is essential for maintaining independence and preventing falls. Even simple activities like regular walks and exercising at home can make a big difference. But how do you know if you're experiencing balance issues? Here are 9 warning signs that you shouldn't ignore. 9 signs of balance problems. Are you aware of all of them? 1. Blurred vision. Could be a sign that something more serious is happening. Blurred vision is not only a nuisance, it can also be a sign of balance problems. If you experience sudden episodes of blurred or double vision, especially accompanied by dizziness or imbalance, it may be indicative of conditions such as migraine, stroke, or vestibular disorders. Do not ignore these symptoms and seek immediate medical evaluation. Additionally, have regular eye exams to detect and treat conditions such as cataracts, glaucoma, and macular degeneration, which can also affect balance. 2. Mental confusion. It's not just tiredness, may indicate an underlying problem. Brain fog, characterized by disorientation, slow thinking, and difficulty concentrating, can be a sign of balance problems. When accompanied by dizziness or unsteadiness, mental confusion may indicate conditions such as postural hypertension, hypoglycemia, low blood sugar, or neurological disorders. Furthermore, mental confusion can increase the risk of falls by impairing the ability to perceive and react to obstacles. If you or a loved one experiences recurring episodes of mental confusion, it is important to seek medical evaluation to identify and treat the underlying cause. But confusion isn't the only cognitive sign of balance problems. See below how the loss of spatial orientation can be a warning. 3. Loss of spatial orientation. Have you ever feel lost suddenly? Loss of spatial orientation, or the feeling of being lost even in familiar surroundings, can be a sign of balance problems. This condition can be caused by vestibular disorders, such as benign paroxysmal positional vertigo, BPPV, or labyrinthitis, which affect the perception of movement and position of the body in space. Additionally, neurological conditions such as Alzheimer's or Parkinson's disease can also cause spatial disorientation. If you experience frequent episodes of disorientation, it is important to seek medical evaluation to determine the cause and begin appropriate treatment. 4. Nausea, vomiting, and diarrhea. Your stomach may be trying to alert you. Gastrointestinal symptoms such as nausea, vomiting, and diarrhea can be signs of balance problems when accompanied by dizziness or vertigo. Vestibular disorders such as vestibular neuronitis or Meniere's disease can cause these symptoms due to the connection between the inner ear and the digestive system. Additionally, conditions such as food poisoning, viral gastroenteritis, or medication side effects can also cause gastrointestinal imbalance and symptoms. If you experience nausea, vomiting, or diarrhea along with dizziness, it is important to seek medical attention to identify and treat the underlying cause. But the physical signs of balance problems don't stop there. See below how your emotions can also be affected. 5. Fear and anxiety. They are influenced more than your emotional. Fear of falling and anxiety related to balance are common in old age, especially in people who have already experienced falls. However, these feelings can create a vicious cycle. Fear leads to avoidance of physical activity, which results in muscle weakness and a greater risk of falls. Additionally, Anxiety can cause physical symptoms, such as tremors and muscle tension, which further impair balance. It is important to address these feelings with a mental health professional and participate in fall prevention programs to regain confidence and mobility. 6. Tremor or weakness in your legs. Your muscles are crying for help. Tremors or weakness in the legs may be signs of balance problems caused by musculoskeletal or neurological conditions. Osteoarthritis, a degenerative joint disease common in old age, can cause pain, stiffness, and instability in the knees and hips. Neurological conditions, such as Parkinson's disease or multiple sclerosis, can affect muscle strength and motor coordination. If you experience tremors or weakness in your legs, it is important to seek medical evaluation to identify the cause and begin appropriate treatment, which may include physical therapy, strengthening exercises, and medications. But signs of balance problems are not limited to localized symptoms. See below how difficulty walking in a straight line can be a warning. 7. Difficulty walking in a straight line. Is something not right in your walk? Difficulty walking in a straight line, also known as unsteady or ataxic gait, can be a sign of balance problems. This condition can be caused by vestibular disorders such as benign paroxysmal positional vertigo, BPE, or vestibular neuronitis, which affect the perception of movement and position of the body in space. Additionally, neurological conditions, such as cerebrovascular accident, CVA, or spinal cord injuries, can also cause changes in gait. If you notice changes in the way you walk, such as lateral deviations or irregular steps, it is important to seek medical evaluation to determine the cause and initiate appropriate treatment, which may include physical therapy and balance exercises. 8. Senses of imminent fall. Has your body realized the risk before you? The feeling of imminent fall, even when there is no apparent risk, can be a sign of balance problems. This condition, known as fear of falling, is common in elderly people who have already experienced falls or who have balance disorders. Fear of falling can lead to avoidance of physical and social activities, resulting in isolation, depression, and an increased risk of falls due to muscle weakness and loss of confidence. If you frequently experience the feeling of an impending fall, it is important to address these feelings with a healthcare professional and participate in fall prevention programs to regain safety and mobility. But signs of balance problems aren't limited to psychological symptoms. See below how fluctuations in blood pressure can destabilize you. 9. Oscillations in blood pressure. An unexpected factor that can destabilize you. Fluctuations in blood pressure, especially postural hypertension, a drop in blood pressure when standing up, can be an unexpected sign of balance problems. When you get up from a sitting or lying position, your blood pressure typically drops temporarily but recovers quickly. However, in some conditions such as dehydration, use of certain medications, or autonomic dysfunction, this drop can be more pronounced and lasting, causing dizziness, blurred vision, and even fainting. If you experience symptoms of postural hypertension, it's important to talk to your doctor to adjust medications if necessary and learn strategies for changing positions safely. How to recover your balance and reduce risks with 7 simple habits. 1. Alternating weight between feet. Improve your balance with this easy exercise. Shifting your weight between your feet is a simple but effective exercise for improving balance. Start standing with your feet shoulder-width apart and supporting yourself on a stable surface if necessary. Slowly shift your weight to one foot, slightly lifting the other off the floor. Hold this position for 10-15 seconds and then switch to the other foot. Repeat 5-10 times on each side, gradually increasing the hold time and reducing the hold as you feel more confident. This exercise strengthens the leg muscles and improves proprioception, perception of the body's position in space. 2. Sitting and standing exercise. Strengthen your legs and avoid falls. The sit-to-stand exercise strengthens leg muscles and enhances balance. Begin by sitting on a firm chair with feet shoulder-width apart and arms crossed over your chest. Lean forward slightly and rise slowly, using only your legs, standing briefly before sitting back down in a controlled manner. Repeat 10-15 times, resting as needed. As you progress, try the exercise without hand support to build strength and coordination, helping with daily tasks like standing or climbing stairs. However, muscle strength alone isn't enough. Practices like yoga can further improve your flexibility and stability. 3. Practice yoga. Gain flexibility and stability at the same time. Regular yoga practice can significantly improve balance, flexibility, and muscle strength. Poses like tree, Vrksasana, Warrior III, Virabhadrasana 3, and chair, Utkatasana, challenge balance while stretching and strengthening the muscles in the legs, hips, and core. Additionally, yoga's emphasis on deep breathing and body awareness can help reduce stress and anxiety, factors that contribute to the risk of falls. Look for yoga classes tailored for seniors or beginners, with an experienced instructor who can offer appropriate modifications and support. Remember to respect your limits and progress gradually to avoid injuries. 4. Balance on one leg. Try it for a few minutes a day and see. Practicing balancing on one leg is a simple yet effective way to enhance stability and prevent falls. Stand with your feet shoulder-width apart, using a stable surface for support if needed. Shift your weight to one leg, lift the other, and hold for 10-15 seconds, focusing on a fixed point for better balance. Switch legs and repeat 5-10 times on each side. As your confidence grows, try balancing without support and extend the holding time. This exercise strengthens leg muscles, enhances proprioception, and prepares you for real-life balance challenges. But there's more. Tai Chi offers additional surprising benefits for stability and well-being. 5. Practice of Tai Chi, the art of slow movement, may be the solution you are looking for. Regular practice of Tai Chi, an ancient Chinese martial art, can significantly improve balance, muscle strength, and flexibility. The slow, fluid, and controlled movements of Tai Chi challenge stability while strengthening the muscles of the legs, hips, and core. Additionally, an emphasis on deep breathing and body awareness can help reduce stress and anxiety, factors that contribute to the risk of falls. Studies show that practicing Tai Chi can reduce the risk of falls by up to 50% in older adults. Look for Tai Chi classes tailored for seniors or beginners, with an experienced instructor who can offer appropriate guidance. Remember to practice regularly to get maximum benefits. 6. Core strengthening. A strong abdomen is essential for a stable base. Strengthening core muscles, abdomen, lower back, and hips is key to improving balance and preventing falls. A strong core stabilizes movements, enhances posture, and reduces back pain. Exercises like planks, bridges, and sloth exercises effectively build core strength. Begin with short durations, gradually increasing as endurance improves, and maintain steady breathing throughout. Pilates and yoga also help strengthen the core while enhancing flexibility and balance. However, stability isn't just about muscle strength. Outdoor walks can further boost balance, well-being, and overall health. Explore the benefits of walking to complement your core training. 7. Regular walks outdoors. In addition to balancing the body, it brings benefits for the mind. Regular outdoor walks improve balance, strengthen leg muscles, and boost mental health. Walking on uneven surfaces like grass or trails enhances proprioception and stability, while sunlight aids vitamin D production for bone health. Nature exposure also reduces stress and lifts mood. Begin with short, flat walks and gradually tackle longer distances and varied terrains. Use proper footwear, carry a phone for emergencies, and, if needed, use assistive devices for safety. Stay hydrated, wear sunscreen, and enjoy the benefits of these simple habits. Alongside walking, make your environment safer to further reduce the risk of falls. Foolish tips to prevent falls. Don't wait until it's too late. 1. Make regular reviews of your medications. Small changes can avoid big problems. Regularly reviewing your medications with a healthcare professional is essential to preventing falls. Some medications, such as antihypertensives, antidepressants, and sedatives, can cause dizziness, drowsiness, and postural hypertension as side effects, increasing the risk of falls. Tell your doctor about all medications you are taking, including supplements and natural remedies, and report any adverse effects. Your doctor may adjust doses, substitute medications, or recommend safer alternatives. Additionally, avoid taking non-prescription medications and limit alcohol consumption, which can interact with certain medications and affect balance. With small changes to your medication routine, you can avoid major stability problems. 2. Take care of the health of your eyes and ears. A visit to the specialist can make all the difference. Taking care of the health of your eyes and ears is essential to prevent falls. Visual problems such as cataracts, glaucoma, and age-related macular degeneration can affect depth perception, contrast sensitivity, and adaptation to light, increasing the risk of trips and falls. Likewise, hearing problems such as hearing loss and vestibular disorders can impair balance and spatial orientation. Get regular checkups with an ophthalmologist and an otolaryngologist to detect and treat conditions early. Wear prescribed glasses and hearing aids as needed, and keep them clean and well-fitting. Additionally, ensure adequate lighting at home and reduce glare with curtains or blinds. With a regular visit to the specialist, you can keep your senses sharp and your balance stable. But preventing falls is not limited to medical care. See below how adapting your home can drastically reduce the risk of accidents. 3. Adapt your home to avoid obstacles. Tripping on rugs or furniture is not worth the risk. Adapting your home to avoid obstacles is one of the most effective measures to prevent falls. Loose carpets, exposed electrical wires, and poorly positioned furniture are common pitfalls that can cause serious trips and falls. Secure rugs with non-slip tapes or consider removing them completely. Arrange electrical wires along walls and away from walkways. Remove or relocate furniture that obstructs frequent paths, especially at night. Install grab bars in the bathroom and handrails on stairs for greater safety. Keep floors clean and dry, and avoid excessively waxing or polishing slippery surfaces. With some simple adaptations to your home, you can transform your home into a safe and welcoming environment. 4. Strengthen your body with physical activities. You don't need a gym. Small exercises already help. Regular physical activity is key to preventing falls and maintaining independence. Strength, balance, and flexibility exercises improve posture, stability, and recovery from imbalances. You don't need a gym. Simple activities like walking, climbing stairs, chair exercises, or practicing yoga or Tai Chi can be effective. Start slowly and increase intensity as you progress, with professional guidance if needed. Warm up before and stretch after to avoid injuries. A stronger body prepares you for daily challenges and reduces fall risks. But remember, prevention also means addressing signs of dizziness or unsteadiness early to avoid future complications. 5. Don't ignore signs of dizziness or instability. Consult a professional at the smallest sign of problem. Don't ignore dizziness or unsteadiness, as they may signal balance issues that raise fall risks. Symptoms like vertigo, blurred vision, confusion, and leg weakness can indicate postural hypertension, vestibular disorders, medication side effects, or neurological conditions. Seek medical help at the first sign of trouble to get an accurate diagnosis and treatment. Your doctor may adjust medications, recommend tests, refer you to specialists, or suggest physical or occupational therapy. Inform family and friends for added support. A proactive approach helps detect and address balance issues early, reducing the risk of falls and improving well-being. Conclusion. What can you do today to prevent falls tomorrow? Preventing falls requires daily attention, proactive habits, and small changes that can make a big difference. Review medications with your doctor, care for your vision and hearing, adapt your home to avoid obstacles, stay active, and address dizziness promptly. Don't wait for a fall. Act now to secure your independence and well-being. Share these tips with loved ones to promote a culture of safety. Every choice today contributes to a safer, healthier future. Take the first step toward lasting stability, balance, and confidence. You deserve to live independently and securely. Start today and enjoy the benefits for years to come.